Hello, greetings. Okay, so let's talk about ectopic pregnancy with Miss Andes Ngalamba. Yes, so the word ectopic basically means abnormal place or location. Yes, the word ectopic, it basically means abnormal place or location. So how do we define ectopic pregnancy? Okay, so we can define ectopic pregnancy by saying this is nothing but a pregnancy complication where the fertilized egg implants in an abnormal location outside the uterine cavity, and it is mainly characterized by abdominal pain and also vaginal bleeding. Yes, that's the definition of ectopic pregnancy. So, in normal instances, implantation, it should be within the uterine cavity. Yes, within the uterine cavity. But in ectopic pregnancy, implantation is outside this cavity. Yes, and it is also vital to note that the uterine cavity is divided in two segments. Yes, we have the upper uterine segment and we also have the lower uterine segment. So the normal implantation is in the upper uterine segment. If implantation occurs in the lower uterine segment, we'll call that as placenta previa. Yes. Then talking about the types. Talking about the types of ectopic pregnancy. So the types of ectopic pregnancy, they are according to the site of implantation. Okay. So the first type is tubal pregnancy. That's the first type of ectopic pregnancy. So tubal pregnancy is the common type of ectopic pregnancy. This one represents about over 95% cases of ectopic pregnancy. Yes. So in tubal ectopic pregnancy, the implantation is in the fallopian tubes. Yes, the implantation is within the fallopian tubes. The second type of ectopic pregnancy is abdominal ectopic pregnancy. So for abdominal ectopic pregnancy, here the implantation is in the abdominal cavity, any of these areas. Yes, so this one is less common. It represents about less than 1.5% cases of ectopic pregnancy. We also have the third type, which is ovarian ectopic pregnancy. So for ovarian ectopic pregnancy, the implantation is in the ovaries, either here or there. Yes. The fourth type of ectopic pregnancy is cervical ectopic pregnancy. Okay, so for cervical ectopic pregnancy, the implantation is in the cervix. Yes, so these are the four types of ectopic pregnancy. So whenever you're asked about the types of ectopic pregnancy, please mention or explain on these four types of EPs. Yes. The other question that you might be asked is on the possible sites. Possible sites of ectopic pregnancy. Okay? So for the possible sites, the possible location or places, we have here, which is the cervix, here, which is the abdomen, okay? We also have right here, female, okay? We also have this part here, Ampule. Yes, the ampulla. The other possible site, we have the isthmus. Yes, the isthmus. Okay? Then we also have here, which is the corner. So these are the possible sites of what? EP implantation. Okay? So I mentioned to say we have the cervix, abdomen, corner, the femoral, ampulla, then we also have the isthmus. So these are the possible sites of what? Implantation. These are the possible sites, these are the types. Yes. Then talking about the predisposing factors. Talking about the predisposing factors of ectopic pregnancy. Yes, the predisposing factors or the risk factors. Okay, so there are so many risk factors. The first one is previous what? Previous ectopic pregnancy. Yes, that's the first what? Predisposing factor. So if you had ectopic pregnancy before, the chances of occurrence is what? Is, I would say, between 20 to 40%. Okay? The second predisposing factor is endometriosis. Okay? So in endometriosis, the cells that lines the uterus, they are found in an abnormal area. So that would bring about what? EP. Okay? The third predisposing factor is what? Previous pelvic inflammatory disease. Yes, previous PIDs. Okay? Pelvic inflammatory disease. That's another what? Predisposing factor. Other than that, we can also talk about STIs. Yes, STIs. Gonorrhea. Yes, is one of the predisposing factor to one having what? Ectopic pregnancy. Finally, but not the least, we can talk about previous tubal surgery. Yes, so if you had any surgery to do with the fallopian tubes, that would predispose you to what? Ectopic pregnancy. Let me also add the sixth one, which is what? Use of what? IUDs. Yes, use of IUDs, which is intrauterine what? Device. That would also predispose one to having what? Pelvic inflammatory disease, including fibroids. Yes. So these are the predisposing factors. So if you had or you have any of these, mean that these can predispose you to have what? Ectopic pregnancy. Okay, they're talking about the clinical features. Talking about the clinical features. The signs and symptoms. So how do we know to say this person might have, or this person has ectopic pregnancy? So the first clinical feature is what? Of course, a positive test, a positive pregnancy test. Okay. The other one we can talk about vaginal bleeding. The third feature is abdominal Okay? The other one we can talk about abdominal distension. Okay? Other than that, we can also talk about tachycardia. Tachycardia is another clinical feature of ectopic pregnancy. Even abdominal tenderness. Yes, abdominal tenderness. That's another clinical feature of ectopic pregnancy. Yes, so these are the clinical features. Then we talk about the management. Talking about the management. One thing that we need to know is the fact that ectopic pregnancy is an emergency condition. Yes, of course, we have ruptured and unruptured ectopic pregnancy. But one thing that we need to know is the fact that ectopic pregnancy, even if it is unruptured, we might not know the time when this ectopic pregnancy to rupture. So we also have to consider that as as an emergency condition. Whether ruptured or not, we need to ensure that we resuscitate the patient. Okay? So talking about the management. Of course, in the management, let's talk about the investigations. So what investigations can be performed in this condition? Okay, we can talk about history taking. Okay, of which this will reveal the predisposing factors. We can talk about physical examination. Okay, physical examination, of course, this will review the clinical features that we talked about. Okay, then we can also talk about pelvic examination. Okay, so pelvic examination, this will review vaginal bleeding. Yes, we can talk about chondrosynthesis. Okay, other than chondrosynthesis, we can also include abdominal ultrasound. Yes, abdominal ultrasound scan. Other than those, we can also talk about full blood count. Yes, so these are some of the investigations that can be performed in in ectopic pregnancy. Not forgetting urine test. Yes, which will show a positive sign of pregnancy. Yes, so these are the investigations that can be performed in ectopic pregnancy. Like I mentioned, we have to prepare the patient for an emergency operation. Okay, as such, we need to ensure that we resuscitate this patient before taking the patient to theater. Make sure that you assess the breathing pattern of the patient, the airway, the circulation. All those they have to be assessed. If there is any abnormality, we need to stabilize the patient. Okay. What are some of the complications of ectopic pregnancy? What are some of the complications of ectopic pregnancy? So ectopic pregnancy may bring about infertility. Okay. The other complication is anemia. Okay. Other than anemia, we can talk about shock. Yes, shock is another complication of ectopic pregnancy. Yes.